Good day everyone. This is a video regarding the mammography case study. There will be two characters in this video. The first character is Miss Lim, who is a radiographer. The second character is Madam ZB, a 46-years-old woman who presents to Miss Lim's office for a well woman examination.
Good morning. I am coming today to have my well women examination.
Good morning. Are you Miss ZB?
Yes, I am.
So according to the record, the doctor has requested a screening mammography procedure for you.
Oh, what should I prepare for the procedure? It is my first time having that procedure.
Okay, Mississippi ZB, before explaining the procedure, I would like to document some of your medical history information. Is it okay?
Yeah, it's okay.
So Miss ZB, do you have any history of breast cancer or any of your family members was having breast cancer before?
No.
Do you take any hormones or medication?
No.
And when is your menarche, and are you on a postmenopausal period?
I have a menarche at the age 11 and I have not reached the postmenopausal period.
Or do you feel any abnormalities on your breast?
No.
Do you have any superficial marks such as prominent mole or scar on breast?
No.
Can you tell me the number of children and your age when the first child was born?
I delivered my only child when I was age of 32 years.
Alright, Mississippi ZB. When it is your turn, the radiographer will ask you to change your shirt in the changing room. There will be a clean hospital gown and you need to wear it with the string in front. When going inside the mammography room, the radiographer will do a physical examination on both of your breasts to check for any palpable lump, nipple abnormalities or breast implant in your breast. If there is any, radiographer will put a skin marker on your breast so that the radiologist can identify it on the image. I will show you the video of the procedure. During the procedure, you are required to stand in front of the machine and take off one side clothes. The radiographer will position your breast by her bare hands. So, you don't feel afraid or shy about that. Later, there is a plate that used to compress your breast. Some people will feel pain while some not. So, I hope you can bear with it, yeah. After done positioning, you cannot move at all. The radiographer will move to the corner which places the control panel. Then, she will start deliver the radiation by pressing the button. So, it is the first projection, then the compression plate will move up and then you can start to relax for a while. You can ask the radiographer to let you rest a while if you are feeling pain. After done with the first projection, then we proceed to do the same positioning for another breast. When it is done, we proceed to third projection. The radiographer will then rotate the machine to an oblique position. In this projection, you are required to lean on your sides. The radiographer will pull your breast with the axillary part during the compression. Therefore, there will be two basic projections for each breast. That's mean your breast will be needed to compress 4 times to get 4 view of image. This is the example of the image that you will get. Till now, do you understand all the procedure?
Okay, I understand.
So, later you will need to wait at the waiting for doctor to review your image. If there is any abnormalities, doctor will request a supplementary ultrasound examination for you in order to further confirm the suspicious findings. However, if the result is normal, you can change your clothes and back home.
Welcome to the information corner. In mammography, there are 2 basic projections. The first one is CC view. So, these are the criteria for CC view image. The second projection is MLO view. These are the criteria for it. We have to always ensure that the images that we take include all these criteria.
My friend was diagnosed with breast cancer 1 month ago. I am quite worried about getting breast cancer too. I have no idea on how much risk that I will get this cancer and how can I do to notice it earlier.
Well, don't worry Miss ZB, nowadays, there are various methods that you can notice it earlier. Before that, let me help you evaluate your risk so that you won't worry much about it.
Oh, I see.
The risk of breast cancer increases from the age of 40 years old for premenopausal group and 50 years old for the postmenopausal group. In Malaysia, breast cancer was detected as early as in the 20s and peaks at 55 years old and declined in the older age groups. Prior history of breast cancer carries an elevated risk of developing new primary breast cancer. Family history of breast cancer is an independent risk factor. The risk is higher in women with breast cancer among young first-degree relative. Sister carries more risk than mother. About 5% to 10% of breast cancer cases are thought to be hereditary, resulting directly from gene defects, called mutations, inherited from a parent. For families with BRCA mutation, the risk may be as high as 80%. Nulliparous or women who had their first child after age 30 have a slightly higher breast cancer risk. Early menarche, before age 12, and or late menopause, after age 55, have a slightly higher risk of breast cancer too.
Oh, I have an early menarche before age 12.
It's okay. The risk increases with the amount of alcohol consumed, long-term heavy smoking, physical inactivity and long-term use of HRT, more than 10 years. Obesity increases estrogen and blood insulin levels, which have been linked to some cancers, including breast cancer. So, now you have understand the risk. I think you can estimate that your risk of getting the breast cancer is actually low since you don't have a family history of breast cancer.
Yes, I understand.
Again, welcome to the information corner. The risk factor for breast cancer can be divided into modifiable risk factor and non-modifiable risk factor. These all are the example for both risk factors. Then, this is a certification of risk factor according to the Ministry of Health Malaysia.
However, you still cannot take it easy. According to your history and your current age, you are encouraged to undergo screening mammography once for 2 years. Our Ministry of Health, MOH, encouraged that women aged 40 to 49 years should not be denied mammography screening if they desire to do. However, it should not be offered routinely.
And oh, I see.
Besides, MOH also promotes breast self-examination, BSE, and annual clinical breast examination by trained health workers as part of the breast cancer awareness campaign since 1995. Although BSE is not proven to reduce breast cancer mortality, it is still being promoted to create breast health awareness, thus empowering women to take responsibility for their own health. However, the coverage for breast cancer screening was not optimum, and thus stronger promotion is required to make women come for breast examination and screening.
Oh, I never heard about this before. Can you teach me how to do BSE?
BSE should be done once a month for those who are still menstruating. The best time is a week after the start of each period, which is day 7 to day 10. For those who no longer have periods, remember a date and do it month, for example, day 1 or last day of the month.
Right, let me jot down first.
Okay. Go ahead. So, now I will show you how to do it. Let's start with step 1. Firstly, you have to stand in front of mirror and check your breast size and shape, thickening of the skin in the breast and underarm area, swelling, warm, redness, or darkening of the breast, dimpling or puckering of breast skin, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one part of the breast. Step 2, look under your breast and look for the same changes as step 1. Also look for the lump and hardness in this area. Step 3, check your nipple for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish or even bloody. Step 4, lie down on the firm surface and using circular motion to feel your breast for any kinds of lump. Follow the circular pattern to cover the whole breast. Check the inner part armpit as well. Always use opposite hand to check the breast. Step 5, stand up and the circular motion as step 4 across each breast. Step 6. If you detect any suspicious, jot down your findings and schedule an appointment with your doctor immediately.
Thank you for your detailed explanation. Do I still need to see a doctor if I don't find anything?
Yes, MOH encourage those aged 30 years and above to get a clinical breast examination, CBE, done by regular healthcare providers on a yearly basis, in which the healthcare worker will look and feel any abnormality in your breast.
Thank you so much. I am really beneficial from your advice.
You are welcome.